So hi guys, so as I mentioned in my first video that my next upcoming video will be about blood thinners, and here we are. As you can see, the hierarchy of the blood thinners. So, and you can see that at the top of this hierarchy we have a group of medication called thrombolytics. So what these guys do, they break down the thrombus, and we have only few medications which does that. These medications mainly are one-shot medications, so we cannot use it for a long period of time. It's only one shot, and it's mainly used in the emergency rooms. Next in this hierarchy we can see the anticoagulant medications. The anticoagulant medications are medications which are they prevent the generation or the occurrence of new thrombus, and at the same time they control the growth of the thrombus which is already present. So yeah, this is the function of this group. The last in this hierarchy are antiplatelet medications. These medications they control the platelet sticking, so they will prevent the sticking of platelets to each other, and this will help also in thinning the blood. In my next slide, I'll be talking about each medication in more detail. For example, for thrombolytics, as I mentioned before, these medication will break the thrombus or the clot, and that is one-time push normally. We have a window from which this medication or in which the medication this medication can be used. For example, we have a window of 3 to 5 hours from the onset of the symptoms, and this time relapse or time duration, this is the only time that the thrombolytics can be used. If the time exceeded this duration, thrombolytics might be not effective. Examples of this medication, we have alteplase, riteplase, and streptokinase. So any medication with A's, which ends with A's, are an example of thrombolytics. So what are the contraindications when we shouldn't use it? As I mentioned before, if we already exceeded the duration of the onset of the symptoms, and if we have active bleeding, we cannot use this medication. And if the patient had a surgery, so 2 weeks following the surgery, we cannot use thrombolytics. Now we're gonna, oh my god, why it's not moving? So we're going to talk about the so these are the groups that comes under anticoagulant medications. We have vitamin K antagonist. Example for that is warfarin, and we all know what warfarin. Heparin derivatives, we have low molecular weight heparin and unfractionated heparin. For the what's happening here? For the factor XA inhibitor, we have rivaroxaban and apixaban, fondaparinux, and dabigatran. In the next slide, we're going to compare between vitamin K antagonist and heparin derivatives. The mode of administration, warfarin is most of the time is oral, and for the unfractionated heparin is IV. Low molecular weight heparin is usually subcutaneous. The onset of the action, usually warfarin has a slow onset of action. It takes at least 5 days in order to show its effectiveness. And for the unfractionated heparin, usually it's consistent. It's constant. So yeah, the effectiveness shows like very fast within 20 minutes. For the monitoring, which is the most important thing when we have to compare between these medication, is that in warfarin we have to check the INR, and it's usually the normal range is 2 to 3. So if the INR of the patient is less than 2, that means we have to either increase we have to increase the dose of warfarin, and if it's more than 3, either we can reduce the dose or withhold warfarin. In case of unfractionated heparin, if it's PTT, which we have to monitor, it's usually should be 46 to 70, and it's same as INR. The same idea is that if it's less than 46, we have to increase the dose, and if it's more than 70, either we decrease the dose or withhold. For the low molecular weight heparin, it's usually we don't need to do any monitoring, but we have to keep an eye on the platelets. Side effects, usually for anticoagulants, most of the anticoagulants, the main side effect is bleeding. So it's bleeding for all these 3 medications. And warfarin, as we can see here in the slide, cross the blood-brain barrier, and heparin derivatives does not. Antidote for these medications: for warfarin we have vitamin K in case of any warfarin toxicity, and for heparin derivatives are the protamine. So this is a summary of a comparison summary of all this medication: warfarin, unfractionated heparin, and low molecular weight heparin. The next slide will be discussing about antiplatelets, and as I mentioned before, it's the weakest blood thinner used. Example for it: aspirin and clopidogrel. These medications are mainly are taken orally, and most of the time this medication does not need any monitoring, but it's the same case as low molecular weight heparin. We just have to keep an eye on the platelets. It should be usually 150 to 400 K. If it's less than that, we have to use these medications in caution. For the side effects, it's the same as anticoagulants. We have bleeding is the main side effect for this medication. So yeah, this was a wrap-up or an overview of the medications which is used to as a blood thinners. I hope my videos are simple and you are getting something from these videos. So yeah, thank you guys, and see you in my next videos. Thank you.